it's Monique, and this is Health 2, and this is Range of Motion Final Exam. As you can see, I always have gloves on. Always wash your hands before you participate with any member or do any kind of care. 15 seconds, scrub. Make sure you do your nails between your fingers and up your wrists. Don't touch anything. Use paper towel to blot dry your hands, and a new piece of paper towel to shut the water off. Okay, so the next thing you want to do is you want to make sure that you introduce yourself and have privacy in the room. Hi Donald, it's Monique today, and I'm going to perform your range of motion. It's exercises on your right leg. Is that all right with you? Fine, perfect. So because you're sitting up, there's only a few limited exercises that we can do. I want you to let me know if there's any pain. I've consulted your chart with the exercises, but let me know if there's any pain or discomfort, and we will stop and make note of it, okay? Excuse me. Is there anything else you need to know from me? No? Okay, Donald. So here we go. The first thing we're going to do is I'm going to feel along your leg, any pain and discomfort. I'm going to look for bruising or anything like that. No, we're good? All right. So I really want to get myself into a comfortable position, and I'm going to cradle. I don't know if you can see this. Let me move the camera a little bit. So you still need to move it a little bit. Oh, there we go. So you're going to cradle. I tried to find socks that had a heel in them so you could see. Cradle his ankle and his foot. You want to get a really good grip on it. And then with your other hand, you're going to put it at the ankle point and use your arm to help flex. And you're going to go for about 5 seconds. You're going to talk to Donald to make sure that there is nothing wrong, there's no pain. He can feel the stretching here. And we're going to do it again. And you really want to make sure you support that joint, and make sure you keep Donald talking or laughing or anything. Keep him involved. Make sure he's breathing. The next exercise that we're going to do, and it's really hard with the dummy, is again, I'm going to support this ankle, same place at the heel, and I want to support behind the knee. Now I picked a sock that went to about the knee, and just like when you're lying in bed, you try and lift it, it goes towards the chest. So when you're sitting in a chair, it might be a little bit harder, but you just have to ask them and make sure that you keep them talking and that they're breathing. And we're going to lift while supporting the joint and up. Is that okay, Donald? And we're going to hold that for 3 to 5 seconds, and we're going to continue doing that. Always supporting, always making sure that everything's okay. And again, support. Perfect. So, and that is range of motion. And you continue with both legs. I was only asked to do the right side, so that's all I'm going to do today. And you always ask your client or member or patient if there was any pain, any residue, and any kind of pain associated with that, and never go past the pain part. Always go by looking at their faces. If they're grimacing and they don't want to say you're hurting them, you really need to pay very close attention to that. We're going to go on to a transfer onto a bed and laying on the left side. So we'll see you in a couple of minutes.